Assalamu alaikum wa rahmatullah. I'm Abdullah Abdurrahman. Today I'm going to talk about our final project proposal. It's MediAI SmartCare. Let's start with when and where we inspired our final project idea. We see that in the hospitals in Malaysia, especially in the hospital next to us, Cyberjaya Hospital, there is overcrowding and patients they didn't get their service uh, in rush. So we searched about it and we found that the most of the Malaysian hospital they face many challenges in smart care with the dealing with the patients. So we search about it and we find a solution to decrease this overcrowding in the hospital and the pressure that came to medical staff. So the Malaysian healthcare system, especially public hospital, faces significant challenge with overcrowding and delays in receiving appointment, particularly for specialized care. That leads to decrease the quality of care and put the pressure on the doctor and nurses. And the patient they need health care and the patient that who need health care they get delayed in their to get their service. So let's start talk about our solution in AI. We inspired solution with the AI. We use three of the AI. We start with machine learning and natural language processing, and predictive analysis. Also, we use intelligent in our project. There is intelligent appointment schedule that came from the natural language processing and patient flow with the machine learning and all the project powered by the predictive analysis. Let's talk about the advantages. Faster and more accurate our uh, our our project, or let's say our apps, our application. There is many advantages in our application. One, it's faster and more accurate compared with the manual system, and there is a significantly reduced waiting time and optimized hospital results. Hospital resource. Uh, since so how we start with the marketing? Our marketing came from since we search about it, and since COVID-19, most of the hospital in Malaysia start looking for some technology to aid them, and a few of them start using AI. Moreover, some application appear like my psychiatra. Many application appears at that time. So we see that there is an option for us in the market, and that we have opportunity to get a place in the market, and it helps the citizens, and we can get some benefit from it. So our target market, we targeting a public and a private hospital in Malaysia and the Ministry Health of Malaysia comparator. So in our target, that in our public and private hospital in Malaysia, for the public hospital in Malaysia, that we have a contract with the Malaysian Ministry of Ministry of Health in Malaysia, and for the private hospital that we can do a contract with them. They can pay monthly. They can pay monthly in our service. So not general management, it's marketing opportunity. That's our next title. For first thing, increased demand for healthcare service in Malaysia. There is, and the second thing, most of the pandemic digitalized push makes AI solution highly unrelevant. The phase how we can build our project. First, we took 1 to 2 months to collect the data from all the resources in Malaysia, ask patients and ask the doctor, and after that we took 3 to 4 months for uh, I made a mistake. So in the our period time it starts with in the first 2 months we collecting the data from the many resources like patients and hospitals, and second for the third and the fourth for the third and the fourth phase we going to develop our predictive AI model for the patient, and in the fifth month we built intelligent appointment schedule and we run it and we see how it works. For the fourth phase, in the 6 months we have applied testing at a single hospital. We can choose a random hospital and we can set up our system in it and we see how it's running. In the seventh month we can launch our last version. So by then from this phase the project will be ready for the users and for the hospitals, and it can help many people, as I'm saying, many people that can get benefit from it, especially hospitals, and our first aim is the citizens. So in our research we want a data science to collect the data and software developer to develop our project, and we need a business analyst to analyze the market and put some rules for us, and we want a domain in a healthcare a healthcare advisor. We can get this service from one of the doctors in Malaysia. So we go into tools, the AI tools and software. We are going to use Python and TransFlow and web framework and web firmware. Infrastructure, we have like cloud and serving. We have serving and cloud and secure database. Uh, our consideration. First, patient data privacy and security. Our consideration is three. First, patient data privacy and security, avoiding algorithm based and ensuring AI support not replace the healthcare professionals. That's our main target. That we are coming to help the doctors and the nurses, not to replace them. So that's for our consideration. For financial projection, we estimate infrastructure. We can for infrastructure we want 20,000 ringgit, and for the marketing we want 10,000 ringgit. For the development we want about 15,000 ringgit. So the cost is 18,000 ringgit. That's to build our project. So where we can gain from, first we can gain from subscription from the hospital. For the, like I said, for the each hospital we put amount. For each hospital they must pay about 5,000 ringgit monthly. and our main potential is the government contracts, so we can get money from it. For future growth, integration, telemedicine, expansion into South extend. We planning to extend our project to Southeast Asia market. There is no many countries use technology in their healthcare system, so that we can set up our project in it, like Philippines or Indonesia or Singapore, and that help us. In the last, we can say that our project help many people to use their uh, uh, help the citizens, and help the government to give the citizens the service that they deserve, and it can get uh, it's next step for the future for the AI. And that I know that AI can handle and can help people, but not replace them. So why not we didn't choose our our final project, and we must apply it in the real world. At last, I'm gonna to introduce you to our prototype. I make it with the Figma, so let's see together.